Hey Marissa, how are you? Welcome in. Hey BB, we just getting started. Just getting started. Definitely share the live, repost. Thank you. Hey Stephanie, welcome in. Let's see, change this lighting. Hey Stephanie, thank you for the repost. Let me see. Hey Destiny, thank you for the repost. Y'all definitely share the live out. Tap the screen. I'm waiting on. Let me see Keisha when she come in the chat. Hey Shell, how are you? Sherelle, how are you? Uh-oh. Coco, did you mean to hit the button to come up? What is all this other stuff on the screen, honey? Hey Toya, welcome in. Hey Monica, welcome in. Welcome in. Okay, boo. Hey Linda, welcome in. Pretty Brown, how are you? All right, let's see here. Keisha?
Hey, boo, I'm here.
Okay, let me turn the volume up.
Yeah, check it for me. You can leave it. It's okay. Hey, y'all.
Friend.
Okay, hold on. Let me do all of my reposting. Did you just get on?
Yeah.
Okay. I said, let me look to see if she on yet.
Honey, you know I was moving slow, trying to figure out
Okay.
which shirt I was gonna put on the cover of this here faja, since we doing pajamas, I'm fajaing tonight.
Oh, got you. Let me share. I'm sharing from all of my pages.
Okay. Welcome in, friends. Thank you so much. Hey Keisha. Hey Coco. I see everyone coming into the live. Nene, we're on Health and Hustle podcast, friends. Y'all know we are committed to building this page up. So we're going to be going live at least once a week from this page. So make sure you are following the Health and Hustle page and turn your notification bells on so that you can catch us when we're on live. Because we got some hot topics. We always talk about something good. And you don't want to miss out because then you have to wait for the repost over on YT. Okay?
Look, come check it. Let me share from my other page.
Okay. Because I sent it to both because I didn't know which one you was going to pop up on.
Both. Both of them.
Thank you for the repost, y'all. Come on in, come on in. I hope you have your water or your nightcap, whatever it is that you drink this time of the evening. It's 9 p.m. Eastern Standard, no, 10 p.m. Eastern Standard Time. So we're gonna come on and give you all a good hour, because the topic's been so good, we've been on for a long time. Let's see, who is this?
Okay. The For You page.
Okay.
That's what I want us to work on, getting onto the For You page. So I see posts from we are on the For You page. Yes.
Hey. Perfect.
I'm so excited. Let me repost.
Okay. This my type of carrying on.
Okay,
cool.
Post it. You guys come on in, share the live as you come in, y'all. Remember to tap the screen as y'all come in. Drop us some FYPs as you come in. We're going to be talking about several different things tonight. If you feel inclined to come up later when Kima does the call for you guys to come up, y'all please come up, even if it's for a second, to engage with us, to let us know who you are. We're trying to make this a little bit more personable so that we can get comfortable with each other, so that when we're out about y'all, that it's like friends that have been knowing each other, but we're now having like a little reunion. I love that feeling. I love putting face to photos and stuff like that, but it feels so good when we can have a conversation now. I love that. So share the live as you come in, tap the screen as you come in, turn your notification bells on so you guys know when I am live. Love that. And engage, you guys. Engage in the comments. Okay. Hold on. I gotta go check one thing. We'll be right back.
Okay. Hey, Max. Thanks for sharing the live, Monica. I appreciate that. And if there is something that is on your hearts that you want to chat about, drop it in the chat too. Because these conversations are not just limited to the health and the hustle. We talk about a lot of things over here. So make sure you drop that in there. And I would definitely take a little note so I can keep up with it. Okay, so we don't forget what you're asking, friends. Because we love it. If you were not able to meet us at the Atlanta meetup, definitely come over to Dallas if you can. The third weekend in October, because we will be at the Dallas meetup as well. So the Health and Hustle podcast, Ask Nurse Kima platform, and Charge Nurse Keisha platform will be present. Hey, Melinda. Hey, Heather. Come on in. Definitely tap the screen. I see the live is continuing to build. Thank God we're out on the FYP. Let me see here. Hey, Carolyn. Okay. No. Keish, do you want to share with the chat the first topic? Because I told them to put some stuff in the chat they want us to hit on, because I got my little notepad over here so we can talk about whatever also.
Okay. First of all, let me send it to you, because I did. Hold on, y'all. Let me get myself together. All right. Let me share some stuff with you.
Boo Bear. This is our Health and Hustle live tonight. So, I'm with Fridays and Keisha is with Amber. So you have to check the links in our bios, friend, and decide which place you want to be, where you want to be, friend. Hey, Diva outside. Welcome in, everybody. Is that Map Breakthrough? Map of Breakthrough. I like that. You got it, Boo Bear.
All right. So before we get into the topics, let me give a couple of shout outs. I'm going to pull the little screen down to see who's in the building tonight. Y'all share the live out. I see there's 92 people in the live. Tap the screen as you come in. Share the live as you come in. Let me give a couple of shout outs. I see Pete is in the chat. Coco. Sherelle is here. Monica C. Hey, Stephanie. Hey, Destiny. Hey, Toya. Teresa G is here. Shay Jordan. Borbear. Missy is in the building. Dina. Larita. Ilya, Crystal, Tanisha, Miss Wright is here, Denise is here, Andrea, Dillion, Beauty, Bestie, welcome in, friend. Hey, KK Dog, Coco is here. Zoom 9791, Crazy Aunt Mary. Hey, friend.
Okay, where you been?
Yes. Mia Moore is in the chat. Tanya, As Spears is in the chat. Cheryl is in the chat. Diva, Aqua Girl, 1984. Miss Juicy is in the building. Tina B. Hey, Miss Bev. H is in the building. Christy, V-Ball, Leah is in the chat. Allison, Merritt, Steel. Oh Lord, I know I'm probably gonna say this wrong, but I'm just gonna say Siobhan. Siobhan is in the chat. T, the mother's in the chat. Sherman Meadows is in the chat. Welcome in, everybody. Mia, y'all, and so many. There's a lot of more people in the chat. So, y'all, thank you guys for coming in the chat. You guys spending some time with us. There are a couple of topics that I do want to talk about. We usually talk about GLP-1s, y'all. So we're gonna be brief on the GLP-1s because again, you know, Health and Hustle is not just about the GLP-1 community. It's about the entire body from head to toe. So just to just one topic that I wanted to bring up was one of the things I thought when you first started your journey, was your priority the pounds down or was it just being healthy? Was the priority pounds down or was it being healthy? Okay. Now for me, I think it was a little bit of both. But if I had to choose which one was most important, the most important one for me was to get the pounds down because my body was hurting. Every single time I would get out of the bed, every single time I would sit down and stand up out of a chair, my legs and my feet would be screaming. Like I was so miserable. You know, I also felt like walking long distances, I would get short-winded. So it really was the health part, but I knew the only way I was going to get to the health part is if I got the pounds down. So Toya said it was pounds for her. Cheryl said it was both. Sister, what's your thoughts?
Honey, call me vain. It was the pounds down. Baby, I was not thinking about no health. I wasn't thinking about none of that. All I was thinking about, let me get this body right. That was it. I'm not going to lie to y'all, okay? Honey, I just don't know any way to be. That's what it was.
Anybody else? Missy said it was both for her. Yeah. I was like, this is not me. You know, I don't know if it was vanity or whatever, but I had looked at some photos of myself, and when I no longer recognized myself in the photos, and like every time I would smile, you couldn't even tell if my eyes was open or if they was closed because my face was so big, y'all. You know, so it's like for me, it was like it was like all of those things. Sunshine says both. She says pound down in order to be healthy. Yeah, friend. I feel the same. Hey, Chris, welcome in. My cousin says I'm still not pounds down. So she said for her it's healthy. Yeah.
Is that Yasha?
Yeah, Yasha.
Okay. Mm-hmm. Hey, Yasha. Listen, and I'm a stroke survivor, right? I really should have been thinking about the healthy piece of it, but I'm not gonna lie. Later on, like the next year, when I found out it helped reduce the risk for heart attacks and strokes, then it was like, okay, I'm winning on both ends. But initially, I was like, let me just get back to 180. Ooh, let me just get that body I had, you know, prior to motherhood. Let me go back there, you know. Mm-hmm. But I'm thankful for both benefits, like really and truly, because if it wasn't for my history as a stroke survivor, I wouldn't be able to get it covered by my insurance. So I'm thankful for what I can get it for. Appreciate it.
Yeah.
Yes.
So another somewhat controversial thing in the GLP-1 community is, which is, you know, I'm leaning more toward one to the other, is there's a lot of people who...
I'm sorry, sister. I just happened to... Did you see Aaron pop in here? He's here. I just happened to see him. He's in here.
Oh, hi, Aaron.
Yes.
Oh, he says body dysmorphia is a huge thing that we talk about, especially after plastic surgery or major weight loss looped in with addictive personalities. Aaron, do you want to come up and talk about that?
Yes.
Do you want to come up and talk about that? Oh my God.
Because that we could get into. Oh my gosh.
That is so good. Oh my God. The addictive personalities.
Aaron's speaking some truth, but drop some gems. Cause honey.
Hold on. Let me see if I can sit on invite. No pressure. No pressure. Y'all, we love Aaron around these parts. Okay. Look me, I was trying to get him. I ain't even the host. I'm like, get him up.
Hello.
Hey.
How are you? The reason I'm only available is because my patient just texted me and was like, I'm not available. I'm on a train. I said, oh, okay, let me see what's on TikTok.
Oh my God. Look, we fan out. When we see you, like, we fan out.
Yes.
Love it. Yes, there's so much drama in the GLP-1 community. Don't even get me started on peptides.
Oh my God.
Which, let me just preface one thing, people that are listening. Please understand that a GLP-1 is a peptide. So understand that. It is a peptide. There's just different types of peptides. And so the term peptide is not new. That's what your GLP-1 was. You just got to do your research and do your own understanding about peptides. That's my 2 cents on peptides for now.
Okay, first, tell everybody who you are.
Yes.
I am a dual certified family nurse practitioner and psychiatric nurse practitioner. I also have, my background is emergency and trauma medicine for over 7 years. I do have a postmaster's in that as well. I just didn't do the board certification because I didn't really like it as a provider. I do weight loss, and I've been doing weight loss. Pretty much met Keisha just as I embarked, and we both were embarking in the GLP-1 world and have been following her ever since. She has been pivotal to my success. She is with a different company. She does not represent me, of course, but she was pivotal in how I embarked in the social media world with GLP-1s. So that's just a little bit about me, but I kind of dabble in a little bit of everything. And in 3 weeks, I'll be opening my brick and mortar in Conroe, Texas.
Go ahead,
I'm so
Aaron.
excited for you.
Yes.
I'm so excited. My husband was like, did you see Aaron's post?
It's been crazy. I got so much going on. I'm barely ever on social media these days. I don't have enough time.
Listen.
Go ahead, sister.
I was gonna say, for everyone that is in the chat, listen, Keisha definitely introduced us to Aaron, and Aaron was definitely my provider as well. So I just want you all to know, okay, we are signing off. AaronIsTheBomb.com for all of the things. Okay, so if you are in the area, Texas area, looking for a provider, tap in with him. Okay, friends, because I love him. Yes.
He treated me. He's treated Kima. I think he's treated my daughter. Maybe have treated my husband as a provider. But awesome. Just awesome.
I treat anybody and everybody. That's how I work.
Mm-hmm.
Okay, and tell them what states you're licensed in.
Oh, sweet baby Jesus. Okay. Let's do the East Coast. It's a little bit easier. So Maryland, DC, Virginia, Pennsylvania, New Mexico, Florida, Texas, Washington State, California. I feel like I'm forgetting somewhere. I think that's everywhere for now. I'm sure there's somewhere I'm forgetting about. But just remember, you don't have to be in the state at the time of your appointment. Meaning, you have to just be in a state that I am licensed in at the time of your appointment. So if you're visiting somebody for, say, in Maryland, but you live in, let's just say Oregon, I can ship to you in Oregon. I just have to establish care with you in the same state that I'm licensed in. If that makes sense.
Yes, I got that.
And we've really started kind of bending the flexibility, especially in the weight loss community, with the state thing. I'm not saying that is the right thing to do. I'm just saying that you can stretch the line as as thin as possible when it comes to the weight loss community, because if you're doing GLP-1s that are coming from a compounded pharmacy, right, the regulations get a little bit easier because we're not using insurance, so we're not billing against a legal entity in that aspect and things like that. But the best thing to do is do it in a state that your provider is licensed in at the time of your appointment, establish that care, and then we can ship wherever. Because I have patients that really do vacation 6 months out of the year in North Carolina or South Carolina, and I ship to them year round, but I'm not licensed there.
Okay. We love you.
Thank you.
Okay.
I love it. I love chatting with y'all. It's been so long. Literally timing is just everything these days.
I know. This is such a pleasant surprise because I know every time you come around, it's going to be a damn good conversation. And the topics are going to be something that we like hadn't even thought about. Like when you said the addictive behavior in the GLP-1 community. Like,
so
as a provider, tell me, what is it that you see? What, I want to know, because like, when you said that, I'm thinking to myself, damn, like, do I have the addictive behavior? Because I even made a post the other day that said, I will never not be on GLP-1s. Like, I would never not, like, ever since I've been taking my NAD because it makes me feel so good, I don't think I will ever not take NAD, glutathione. Those are the things that I stack. Right now, I am researching inflammation peps. Now, I'm not liking what I'm finding, according to clinical studies and, not seeing like the human trials. But because so many people are talking about they're feeling great about these meds, that, it's changing them, it makes me so interested because of my history with, vascular necrosis. So, I'm like, is this hopeful? So what do you think? What's your thoughts? Like, what do you see as a provider? What are your thoughts?
So addictive personality, right? So a number one thing, right? So when you look at weight loss, I talk to people about this all the time, right? We talk about, right? The first thing I say is it's not always about overeating, right? That's not true. Not everybody's an overeater. But those that are overeaters or sympathy eaters, right? What is happening? You are feeding your reward center. Your body is craving a reward to make you feel better. Well, we have one reward center. That's the same reward center that heroin goes to, that alcohol goes to, that nicotine goes to, that food goes to. So another thing we noticed and why we're studying it in alcoholism is many people on GLP-1s report consuming significantly less alcohol. Why? Because the GLP-1 is going and binding to your reward center. That's why your food noise turns off. That's why your interests in certain things turn off, because you no longer have that want, that craving. Your body is not asking for the reward. Most people have an overindulgence in something. If it's not food, it might be alcohol. It might be nicotine. It might be shopping. It doesn't matter. Reward is reward. But we find that a lot of people will replace one vice with another, right? So people that replace smoking cigarettes with vaping, you didn't stop smoking, you just changed the delivery. People that have an overeating issue, okay, they got rid of that, but now they're overdoing their weight loss. Now they're looking, as we like to say, cachexic, fancy word for too skinny, or now they're stacking all of these things and they want more and they want more and they want more and they want more and they're never satisfied. Well, that's because now you're feeding a new addiction. You've just replaced one vice for another. So self-awareness is going to be huge. And then you start talking about body dysmorphia. So you lose all this weight and now you have, excess skin. So you don't like how that looks. So now you want to get rid of your excess skin. Okay, fine. You get rid of your excess skin. Now that you got rid of your excess skin, well, I feel like I could get a little bit tighter here. And I feel like this could look better. And now I want Botox here and I want this done here and I want this a little bit better. Now you're having a problem with how your body appears. And that can be body dysmorphia. We also show that, or know, and your plastic surgeon will not tell you this, if you have anything on your body changed, Remember that when you look in the mirror, your eyes are not going to recognize the person in front of them because you've changed something that it hasn't seen ever before. And I saw this with a good friend of mine who had a nose job, and she's a provider, and she was like, I don't recognize my face. And I said, well, that makes complete sense because you don't know that face.
Mm-hmm. Mm-hmm.
I've recently had some work done myself, and just seeing the look of other people's face when they see what my scars and stuff, they're like, oh my God, like what is going on? And then I look at myself and I'm like, yeah, I guess I do look a little different, don't I? But it's it can be a shock factor, but we all can gain addiction. You can gain an addiction to weight loss. You can gain an addiction to, look at the people, we call them gym rats, right? Kind of derogatory, but there are people that overdo it. You can overdo it. You can do too much workout. You can get too skinny. You can get too big. You can get too thick, right? Just remember, everything comes, I tell everybody that just take it with a grain of salt and remember that you have to find what's best for you. And that isn't always defined by what we say on paper, meaning a BMI is one size fits all. I hate BMI. I don't use it. It's a guide.
Yeah.
So just because you're not falling into that doesn't mean that you've done something wrong, or that you're not where you should be. You need to be happy with the person in front of you in the mirror. And sometimes that causes retraining. You have to remind yourself that it's okay if I have this excess skin, but now I'm 50 pounds lighter. So that's okay. I traded one evil, and now I have something new that's positive. I'm healthier. I can move quicker. I just got excess skin.
For someone who cannot identify addictive behavior, like all the things that you're describing, if someone is on their GLP-1 journey and okay, now they have so they're taking these things, now they're getting to the point where they have to have the skin removal. So then now they cannot identify themselves because they've had the skin removal, and they're like, well, let me tweak this and let me tweak this. And in their mind, it could possibly be that, it's a therapeutic thing. Like it makes them look better. It makes them feel better because they feel like they look better. How can someone identify when it is not healthy?
Sure. So the big thing is listen to your surrounding. Listen to your significant other. Listen to your best friend. Listen to any of your friends. People that know you and care about you are going to comment. My spouse did. When I had my plastic surgery, my spouse was like, this better not be the start of something. I'm concerned, like, why are you doing this? And I'm doing it for me because I want to and I can afford it right now. And I want this. I've always wanted this. But it was, he checked in with me and was like, look, like, this is okay, but don't do this. And I don't want you to be doing that. Fair enough. But one thing is, if you're questioning it, because 9 times out of 10, you're going to question yourself. Like, do I have a problem?
Mm-hmm.
Ask yourself, what are you going to do if the answer, what about if I told you no more GLP-1s, you're done? What about if I told you no more peptides? What is your innate response? Are you panicking? Are you doing what an alcoholic does, right? When an alcoholic is running out of alcohol, but they're too drunk to drive, but they can't get alcohol, they start immediately panicking. They go into a full-blown panic attack because they know they need that alcohol to survive. Do you need your GLP-1 to survive? Or are you going to go, you know what? I'm going to pivot, and this is what I'm going to do. If I told you no today, what is your innate response? And if you start panicking, that's a problem. That means you've become reliant on something. These are tools. Tools are okay to have and need and want to use. But what about if I told you tomorrow is all gone? Yes, immediately you're going to be like, oh my gosh, I'm going to gain weight again. Okay, yeah, it's normal to get freaked out. But how bad does your panic look like? Are you losing your shit? Are you ordering everything up now? Let me order 100 milligrams of everything so I have enough, right? Are you panicking? Or you go, okay, I'm going to get a 3-month supply and then I'm going to pivot and figure out what I'm going to do next, right? What is your innate response? When you're out drinking with your friends and they go, and they call last call, do you order 1 drink or do you order 3?
Mm-hmm. Those are good points. That's
2 is fair. The 2 is in the middle, right? But these are behaviors that you can check yourself with. Do you overindulge? My friend, for example, when something's on sale, she'll buy all of it.
mm,
And it's like, okay, well, it was on sale. I do it too. Even if I don't need it, I'll buy it, but I don't buy all of it. She has literally bought out Bath and Body Works 75% off. Like, she'll buy the whole rack. I'm like, girl, you got a problem.
so thank you, Aaron, because I'm gonna have a transparent moment. So I've had tummy tuck and muscle repair, and I just recently was having this conversation with Keisha about changing my stacks starting next month based on me doing this body recomp. Now my waist is tiny, but for whatever reason, I want it to be even smaller. Like I have it in my head, like I'm not satisfied
Tell them
with
how many inches it is.
right now it's 25, but I want it to be like 21 or 22. Okay. Now, where did I get that number from, Aaron? I don't know, but that's what I am working towards right now. So I understand when you talk about body dysmorphia because I look in the mirror and I look good and I know I do, but it's like I can do a little bit more. What if I change this and change that? Like I've already reached out to my doctor to have a consultation for boobs or whatever. It's like in my mind, if I want to look a certain way in my 2-piece, because I don't want ain't no such thing as a cover up in my mind. But I struggle with that. But I feel like, maybe some people could not understand, can't understand why I feel that way because I've lost so much. So it's like I've heard someone say I should be satisfied with where I'm at right now. But I'm like, I'm happy. My husband's happy, but I want a little bit more.
And there's nothing wrong with that, right? So you want a little bit more. That's just like the surgery I just did. I had gynecomastia surgery. So I basically had a mastectomy.
Mm-hmm.
And now I have scars across my chest, just like any female would if they had their breasts removed.
Mm-hmm.
And everyone's like, why did you do that to yourself? And I'm like, because I've always hated the way my chest looked. I've always hated it. And now I'm having my thighs done and I'm going to have some skin tightening done when I go back in September. And my husband's like, what are you doing? Like, we talked about this, like, enough is enough. And I'm like, I don't think that it's gotten to a point where I've exceeded what is reasonable.
Mm-hmm.
I'm not doing anything that's not reasonable, right? Like your waistline is a reasonable number. It's not an unhealthy number. You said, like you said, it's arbitrary. I don't know where I got it from. That's okay. Is it healthy? And that's what I ask every single patient. Is it healthy? If it's healthy, it's okay. If it wasn't healthy, my surgeon wouldn't let me do it. So I know that I'm still within my rights and my parameters, but let's say my surgeon said no, or your surgeon said no, and now you're starting to look for a surgeon that says yes. That's a problem, right? Because you're not accepting the no, and that's when you have to start questioning, like, what am I doing here? Do I have a problem?
And you know what? Because I knew someone like that she reached out to me, gonna have surgery, and she said, well, Kim, what do you think? You lost a lot of weight. What do you think? And I said, I would do it in sections. She said, but I really want to do it all at one time. She said, but my doctor's not comfortable with it. And I said, anytime your physician verbally tells you that they are not comfortable doing a procedure, take it at face value. Do not try to pressure them to move forward. And it is sad to say that that young lady is not here anymore because she pressured her doctor into doing it and she never recovered from it.
We talk about it all the time, like BBLs, people that are so obsessed with getting a BBL, right? That is the number one procedure that I will always tell my patients. I do not support it. I do not agree with you. It is not worth it. If you feel like you need that, you need to check the people you are with that makes you feel that way. There are certain procedures that I'm okay with, but a BBL
Why,
so
Aaron?
dangerous.
That one, I feel like I took a stray.
It is a high mortality rate, very high mortality rate.
Mm-hmm.
Oh, okay.
Yeah, so the complications, post-op complications are so great, and most people don't do it within the United States, so the follow-up and post-op care is missing. There are plenty of surgeons that do wonderful BBLs, don't get me wrong. If you follow the right pathway, I will support it. But most people don't because of the cost, right? They go out of the country. They're going to get, a lot of times they throw a clot and that's why they die.
Okay. Now, Aaron, you done tapped in something. You don't even know you done tapped on my front door with what you just said about going out the country. Because I thought about that one time, but like I've seen people that have had procedures done, some good, some not so good, as far as going out of the country. If someone, in your opinion, not medical advice, in your opinion, if someone was to go out the country and have a procedure done, do you feel like there's a certain amount of time they need to stay in that country and have so many follow-ups? So what would that look like in your opinion to reduce the risk?
So I think that you need to do your due diligence and research and try to find true reviews, coordinate or talk to somebody. I mean, look, social media is a huge tool. Talk to somebody who had it done. Somebody's used it and posted a video about it. But I'm going to give you a prime example of what really chaps my ass. And that is people that go and get their teeth done outside the country. It is not normal to have all of your teeth ripped out of your mouth and implants put in the window in which you can get it done. You have zero heal time. Do you know how many people come back with complications? It is ridiculous. You cannot rip something out of the mouth and put something implanted right back in. You can't do that without proper timing. But how many people come back with perfect teeth? Look at the color, look at the spacing, look at those things. I get it. It's cheaper. And sometimes chasing a dollar sign can get the best of us. But do your due diligence. Look at people that have gone through it. Look for that research. The more high risk a procedure is, the longer that you should plan on staying there for recovery so that you can have, if there is a complication, you can follow up the person that did it. Because guess what? When you get to the United States, you're going to have a hell of a time with somebody touching you. That happened to my sister. She went out of the country, got surgery. She got a tummy tuck. Nobody would do her wound care. She wasn't healing. She was rejecting her sutures, and nobody wanted to touch her because she didn't have it done here.
Yeah.
And luckily, she's a nurse, and there's me. So, like, the two of us are winging this wound care over here. And I'm like, all right, I'm going to teach you what I learned from the wound care nurse that I know best. But the point is, think about worst case, and that's how we're trained as in the medical field, especially as nurses. Think worst case scenario, and what are you going to do if that happens? And if you have a solution for that, then great. You've thought of worst case and best case.
Okay. There was someone in the chat, Keisha, Sabrina, and I wanted to ask her. Well, I did ask if she wanted to come up because she said that, this is a topic she wanted to kind of dig into. So I wanted to give her the opportunity to come up if she wanted to ask her a question or say what it is that she was trying to say. So I'm going to see. But then go ahead, sister.
Did you also see where Kelly says, I'm recovering from a tummy tuck right now? She said it's been rough. Now she's saying that her belly button is infected. So yeah, there's post-op complications can happen with a lot of things. With a lot of different surgeries. I think what Erin is saying is like you want to make sure you are going with clinicians that are trained to do what it is that you want them to do. Because I know a lot of people who have procedures done by clinicians who that procedure is not even their specialty. And they get it done because of prices and stuff like that. Not saying that's what you did, friend, but I'm just saying she just made a comment. And she just made a comment about that. And if there is anyone in the chat that wants to come up and discuss this with us, you guys are welcome to come up now. I don't want y'all to think that we're just three people having a conversation. This is a community conversation.
Yeah.
Anything I say, please take everything I say with a grain of salt. That's what I always tell you. Do your due diligence, but ask me anything.
Yeah,
absolutely.
And listen, when we said about the people coming from out of the country to get, going out of the country to get their teeth done, we get a lot of patients that come in through the ER with those type of issues that we have to treat for, like post-op infections. Post-op infections is usually, or dry sockets. We get a lot of dry sockets from those pulled. And then for the BBL people that go out of the country and they come, it'd be a lot of dehiscence. We get a lot of dehiscence patients. That's where their surgical sites will separate because of infection. And Yeah. That is accurate.
And it's not an attack. I mean, I'm sure there's wonderful surgeons and people have had wonderful
Yeah.
surgeries, but there's also, with social media, people capitalize on this. Look at how many people got busted for doing dental implants that weren't even dentists. For the love of God.
That was crazy. That's crazy. It was definitely running rampant up here in Atlanta, for sure.
Yeah.
Aaron, Sabrina's asking about your sister. Is your sister okay?
Oh yeah, she's fine. We took care of it. Luckily, she's a nurse, and she recognized what was going on. It ended up being that she was rejecting the sutures. The sutures were actually pushing through. So what was happening was it kept basically causing the wound to reopen. So we were able to find a wound care place that would at least remove the sutures so that she could heal.
If there's anyone in the chat that wants to come up on the panel, please hit the request button. We definitely welcome the conversations. Let's see here.
And like I said, time is so precious. I'm going to have to jump, y'all. Any questions for me before I jump?
Anyone have any?
I have one question before. I have one question before you go, Andrea. Can you mute your phone for 1 second, baby? What are your thoughts on peptides? What is your thoughts on peptides?
That is a loaded question. So, am I taking peptides? Yes. But am I also a healthcare provider that does everything that I'm not supposed to do? Also, yes. I think that there is a lot of research to still be had. The biggest concern that I have was the possibility of the cancer-provoking side effects that can occur, because you talk about, right, what is cancer? Proliferation of cells. And we're asking our body to now do things that it doesn't normally do.
And so I was sharing with Keisha a couple of weeks ago about this class that I took. It was like for work, but it was some research shared that they were testing these MEDs on cancer patients, breast cancer, liver cancer, and lung cancer patients to see if they could improve their outcomes with taking these MEDs, including some of these inflammation peptides. But it was over in Europe, and it was not that many. And when I say not that many, it was like 12,000 people, and I consider that not that many people, considering the billions of people in the world. But it was just interesting to find out where these peptides are being tested for what types of patients, in those areas. So that was interesting to run across.
Yeah, it's very fascinating. I think there's a lot to still understand and unpack with them. I am trialing some of them, but let me give you a prime example of what I learned the other day. I was going to do tesamorelin and something else, and my boss, who is weight loss certified and a family medicine provider, she said to me, I was telling her, I was like, look, I want to do tesamorelin. I've gained a lot of weight since switching from tirzepatide to retatrutide, because there is a bridge when you do that, and it's been a miserable one for me. But she said, I said, I'm so swollen. I've got like 2+ pitting edema in my lower extremities, which I don't normally have. And she said to me, well, don't do tesamorelin. She was like, it can cause edema. I was like, well, shit, I'm glad you took the class, because I didn't know. So there's so much unknown about these. So you need a provider. This is me inserting my own ignorance. You need a provider that understands what they're doing. I prescribe peptides, but I have a lengthy form that I send to my patients. I'm like, you need to read this. This is what I've learned about them. This is what I know, and you must sign a consent. I'm still learning just like everybody else. And so, I knew that the tesamorelin was supposed to help with my visceral fat, and that's where my concern was. And I knew all of the things that I wanted it for. I did not know that edema was one of the side effects. And I'm like, well, shit, I'm already got 2+. I don't need any more.
Yeah.
So these are things that, just remember, just because we have the credentials behind our name, don't always trust us. You should always question and do your own research.
Yes, and here's the thing. Here's the thing, Aaron. I've been researching just BPC 157 KPV. I've been researching TB 500 because of the inflammation. things that I deal with. And the thing that I'm finding most is that there is like a severe limited studies with humans. There's a
Sure.
lot of test tube studies, there's a lot of mice studies, but very limited with humans, and that makes me nervous. Because if you haven't had research with, and listen, I'm gonna tell you, I am very I feel like in the next coming months that I will be taking inflammation peptides. I'm almost certain of it. But I am also aware that there's limited human studies. I am aware that because there's limited human studies that I cannot, dosing is not guaranteed to me. Toxicity is not guaranteed to me, or knowing the toxicity levels, knowing if I'm
Exactly.
taking enough, you know what I mean, to see the change. So I am aware of that. And I think that if people are wanting to take peptides, if you can acknowledge that there is no human studies that's going to give you the dosing to give you the therapeutic effect, and you still want to take it, then fine. And then I also believe that there is a such thing as placebo effects.
Oh
Sometimes we
yeah.
want things to work so much that we mentally think that it's working, but it's physically not making any changes. So I wonder if people think about those things.
They don't. I mean, providers may a little bit, but patients don't because they don't know to think that way. Everybody just wants. And there's nothing wrong with that. I wanted. When I heard that there was a way to
Yeah.
lose weight without me going to the gym, yes, please sign me up. I'll take 2 to
Yeah.
go. Thank you. But we have to do our due diligence, and that is where everybody falls short. I think as providers, we don't as much because we have to do it's our license that we're trying to protect at the end of the day. But it doesn't mean we're always doing our due diligence. And that's why I tell my patients all the time, if I don't understand something, I'm going to tell you I don't understand it. Like, I'm not
Yes.
going to lie to you. I
Right.
will. And then if we both agree the risk versus the benefit, like, I don't know everything and you're okay with that and I'm okay with you taking it, then we both have discussed it to the best of our knowledge and our ability. But that's important. And what I think people need to recognize is very few people will admit to their lack of understanding. And I think
Yeah.
that's what's up. You must be willing to, humble yourself, right? Because I have I don't know everything. I seriously don't. And if I don't know something, I'm going to be the first to tell you, I don't know. I'll either look into it or I will tell you, I just don't know.
Yeah. Yeah.
And there's nothing wrong with that. But do your due diligence. Don't trust. The number one thing, and I'm sure Keisha can vouch for this one, is I cannot stand when I ask a patient, even though I know clinically, why are you on this medication? Because my doctor told me to.
Oh yeah.
I'm like, but why? Because they told me to. I don't ask questions. Okay, well, one, shame on them for not educating you. Two, shame on you for not asking a question. I could write you a pill and tell you it's good for you, but doesn't mean you should take it. Do you ask questions?
Yeah. Kima and I have been educating the community about asking more questions to their clinicians and being more of an advocate for themselves and not feeling like they're challenging their provider because they're asking questions, but look more to it like you're critically thinking and advocating for yourself. Your doctors will respect you. They won't be offended. They'll respect you.
Yeah. And, it's funny, you were saying something, and this is my parting word, but part of my peptide consent, it states the following. I understand that some peptide medications are FDA approved for certain medical conditions and indications, but I also understand that compounded medications are not FDA approved, which means the FDA does not review the compounded medication for safety, effectiveness, or quality before they are dispensed. Compound medications may vary from commercially manufactured medications in formulation, concentration, inactive ingredients, additives, sterility, packaging, and dosing. That is part of my consent, and that is where you need to make yourself educated. I am telling you the big, bad, and the ugly, and I'm being very transparent about it. And as long as you're okay with understanding that, great. I say all that to say, please read the consent. Read what you're signing.
Love that. Love that, Aaron. It's
So.
been such a pleasure having you here with
Oh,
us.
it's been a
Love to see
pleasure.
you.
I feel I gotta get my presents back, especially with opening up my brick and mortar, but I appreciate you both having me on. Keisha, you look fabulous as always. Hurry up and finish school because bitch, I need a provider. Thank you. And outside of that, y'all have a wonderful weekend and I will talk to you soon, hopefully.
All right.
Take care. Be safe, everyone.
Thank you. Hey, Andrea. Girl, we didn't forget about you, girl. What you got going on?
Hold on, let me unmute her. Oh shoot. I'm trying to unmute you. Oh, let me do this. Let me bring her back. Honey, I learned how to mute from the phone.
How to do that?
Hello. So Andrea, hit it back. The request to come back, friend, because I couldn't unmute it. I couldn't unmute it for you to come back.
That's good.
You cooking that pasta? Let me see here. And side to side, were you trying to come up, Toya? Or was that an accident? Oh, okay. Absolutely not. Got it.
We're going to do this pasta tonight.
Oh, that's going to be so good. Oh, God. I'm so feeling, y'all.
Right quick.
So what, to Aaron's point that he was making before he left off, that's what Keisha and I were talking about on our last live. Like, when you're getting your medication from different vendors, even though you might use a peptide calculator that's online, how do you know that peptide calculator works for the particular vendor that you got your meds from? Even though it might say, the vial might be the same. Like, how do you know? That was my question, because I know I don't. You know what I mean? Hey, Miss Nadine, welcome in, everyone. If you are not yet following the Health and Hustle podcast, take a moment to stop, drink your water, and hit that follow button on the profile and turn your notification bell on so you can catch us when we go live on this podcast. This page is definitely a once a week right now, but you'll see content that continues to go throughout the week. And make sure that you are following both pages, the Health and Hustle page. I think Keisha's big page is here. Keisha, are you logged in from your other page? Okay. So I'm going to drop some hearts in the chat so you all can see my main page as well, to follow that page as well. Keisha, can you drop something in from your other one?
Yes. Okay. Let me go
They
get my
can
phone.
see it, because we can't pin while we up here like this. So y'all have to make sure you tap on our names so that you can make sure that you are following on all other pages. But welcome in. So we were talking about, just a recap, of course, the GLPs and the peptides, what's good, what's safe, what people are indulging in. And of course, Keisha and myself both are into the inflammation, anti-inflammation peptides, because we both kind of suffer with some of the similar things. So I'm excited about what's to drop the end of the month. I'm not even gonna lie. I'm extremely excited. Uh-oh. I don't know what happened to Keisha's page. I don't know if she meant to do that. Let me see if I send an invite to the other page. I just wanna run. Okay. Let's see if that works. And drink my... There we go.
Okay. Sorry about that.
No, you're good. And I'm glad Aaron brought up that conversation about body dysmorphia after having the procedure done. Because you cannot tell me that this whole getting the peptides and stacking up, like the number of boxes, kits that I see people have like on their videos, it's like they are the new pharmacy. You know what I'm saying? And when I look at them, I'm like, is it for them, or is it for them to help other people? Or is it just because I want to see it stacked up to say I have it. You know what I mean? Speaking of like transfer of addictions, like yes, being at your goal and now I'm shopping more, or I am going out drinking more. Like, I've seen that happen before we got into the GLP-1s, literally after people had bariatric procedures. That was something I saw a lot of, a transfer of addictions. It went from the food to alcohol. For some people, it went from food to shopping. But we saw like clothes that stacked up with the tags on that they would never wear, like years worth of clothes. But it's just the idea of being able to make those purchases. Hey, Donna, welcome
And listen, I don't want anyone to be confused about our views on peptides. We love peptides. Let me be clear. I love peptides. I want to take peptides so bad. I just have to make sure that with my medical history and with my current health that I'm able to take them and that I'm doing myself a service instead of a disservice. So I have to research and make sure that it's okay, for me to do those things and reach out to people who know more than me about those things so that I can make sure that that I don't hurt myself, But
Yes.
at the end of the day, we do give facts about them. We do talk about evidence-based practice. We do talk about clinical studies. And I know some people don't want to hear that there's no human clinical studies or there's no evidence-based material on a lot of these inflammation peptides, but that's the truth. You know what I'm saying? So we want to give you the truth and let you make your educated decision. I know that there's it's extremely limited human trials done on inflammation peptides. But because I see so many people, they're able to run, they're able to work out, they're able to do all of these things. I'm like, this not in their head. You know what I'm saying? Like there is something physical going on with them. And it's probably the peptide that they're taking. So I want to see personally, I don't want to wake up hurting every day, especially when I know I'm looking at someone who is taking a med that's helping them. That's just like a cancer patient who takes research meds for cancer. If I have cancer and there's a research medicine that can help me or possibly help me survive this thing, I'm about to take it. I want to be on the research. You understand what I'm saying? So it's no different. We just want you guys to have the facts so that you know everything and not just being influenced by people that you don't know. Because it's really people that we don't know.
That's right. And someone put that in the chat. I believe that was Kelly that put it in the chat that said there's so many influencers on the website trying to give medical advice, and you're right. I see that a lot. Keisha and I talk about that as well because I have no problem with anyone sharing their journey because everybody's journey is different regardless of what you use. Like I have no dog in that fight. Do what you like. You know what I mean? But sometimes I do feel a way when I see influencers giving medical advice. Here I am constantly saying no medical advice, no medical advice, no medical advice, because I definitely have to protect my license. But then I see and hear other influencers that, are telling you how to dose, when to dose. Like that's insane to me, but that's because I know better as a clinician. You know what I mean? And it's unfortunate because if something happens to individuals based on the information that they have taken from someone that is non-clinical, like you are really at fault for that, so we have to remain ethical in the information that we are sharing and be a reminder and a good steward of our neighbors to not attempt to give medical advice when we are operating in a different scope.
Right.
Monica C says, most times when I'm in the peptide live, I have about 10 new followers that are in my inbox. I believe it. I absolutely believe that. My inbox stays full with a million questions about all the things, and I never try to make people feel bad because, like I said, I have no problem, honey. Do what you like. I just want you to know what you're doing and understand.
That's it.
Informed consent to say this is what I want and I understand and move on, honey. Fine with me, baby.
Mm-hmm.
You like it, I love it. You know what I mean? We have about 20 more minutes, you all, on this live. So if there's anyone in the chat that wants to come up, share your journey, talk about some things, ask some questions, please feel free to do that. Just hit the request button to come up. We have no problem. Say what you want to say, ask your questions, and then so that we can speak to everyone that wants to come up. Okay. Nurse Watts says, sorry, they are not studying themselves. Right. Thank you for the follow, Nico. Make sure you are all following the Health and Hustle podcast. This is our page where we come on every week until we maybe can get to a place where we can do a little bit more. You know, we both are in school, get our nurse practitioner license. So, you know, and then we have our other platforms also.
Yes. So does anybody want to come up on the panel to share wins? Not just in the GLP-1 community. It can be your labs look better. It could be you your blood pressure is better. It could be you got approved for sleep apnea, so you can tell us how you did it. It could be anything health-wise. If anybody has any wins, y'all feel comfortable to come up. This is a safe place for you to come up and share. You don't even have to turn your picture on. We welcome you to come up and share anything. Okay. There was some other things that I had wanted to talk about. Just moving away from obesity, because I don't want you guys to expect obesity talk every time y'all come on Health and Hustle. We want to branch out to other stuff. So I wanted to talk about anxiety and depression. I wanted to tap on the many hats that people wear, and how sometimes we can get caught up in having anxiety and depression and not recognizing what it is and not getting the help for it. I know for me, I do suffer with anxiety, you guys, which is crazy because my anxiety doesn't show itself as like me spazzing out, me walking around, moving things, you know, having to clean up all the time. My anxiety doesn't show up that way. My anxiety causes me to seclude myself. I like a lot of quiet. I like a lot of peace. But even though I like a lot of quiet, and peace, even when I'm by myself, it's like it's like my brain doesn't turn off. It's like I'm constantly thinking, constantly trying to plan, constantly trying to, organize my life, my finances, my content, my schoolwork. And it's like I'm always doing that. And it's like sometimes what I do to shut my brain off is I'll get my iPad and I'll play my little game, Wizard of Oz. And when I'm playing my little game, Wizard of Oz, it takes me out of all of that chaos. So what I did was, for my anxiety, I reached out to my provider. This was some time back, y'all. This is probably like maybe a year and a half ago, to let her know that, when I come from work, it's like I can't calm down. I can't settle myself down and I can't sleep. So she put me on Lexapro. And she put me on Lexapro for the anxiety, and I've had to increase my dose because at first she put me on 10. And I was like, I'm still having like the thoughts, like my brain is still like wanting to control me and it doesn't want me to sleep. So then she upped my Lexapro to 20 milligrams, and then she put me on Trazodone. Trazodone is an antidepressive med, but she uses it for me for insomnia. So if anybody is experiencing anything like that, any anxiety, any depression that you want to talk about, that we can possibly give some insight on, y'all come up. Let's talk about it, because sometimes your anxiety can cause you to seclude yourself. I mean, your anxiety and depression can cause you to seclude yourself. It can cause you to be short-tempered. It can cause you to be impatient. It can cause you to be reckless. So, and a lot of us are displaying those things and not even realizing that it is a form of anxiety or depression. So if you have any questions or comments or stories to tell, we would love to have you. Yes. Miss Tracy said, my first panic attack in a long time was this past weekend. Tracy, come up and tell us what happened. I want to know, boo. Tell me what happened, baby. Adonica says, my brain be on 1,000. And so my thought is, Adonica, does your clinician know? Did you reach out to, because that's not normal, boo. It's not normal. It could be some things that you can do to help yourself and not even get on medicine, because not everybody who have those type of issues want to get on medicine. You don't necessarily have to be on medicine to treat yourself. Hey, Mama!
Hi, guys. How are you? Good. How are you guys? I'm sneaking in here real quick. I'm not even
Okay.
supposed to be on this statement. I just want
Okay.
a couple of things. Couple of things.
Okay. Let me mute
I
myself.
I adore both. Just adore. Love y'all down. Thank you guys for what you do. Everything you guys have been talking about, it's been hitting, 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 hitting. Every single thing you guys have talked about. The who doesn't have transfer addiction in this community, right? Who doesn't have and if you don't, if you haven't recognized it, take a look at your patterns, right? Take a look at what you've filled, because the vast majority of us were filling that with food, right? Filling that dopamine hit, dopamine hit, dopamine hit. So when that quieted with this class of medication, mine very quickly went to shopping, the gym, dopamine hit. So everything y'all were saying about that. Now, the body dysmorphia has got me in a choke hold, in a choke hold. Like, I'm down for my highest, I'm down 160. And when I look in the mirror, there are times that I still see that the highest, right? And it's because I train, like what you guys were talking about earlier, people who just get addicted to the gym just over and over and over again. That's just, I have, because I don't have a weight goal. I have a body goal. I want to be a muscle mommy, right? Y'all saw my husband. Y'all saw my husband. Okay. So I be in the gym. I be in the gym, but I can't see my gains. I can't see. Look at this skin. I have muscle. I just can't see it.
Yeah.
So that's so hard for me, you guys. That's so hard for me. Y'all don't
You
even know
can't
the
see
way
it
I
because you
work.
look at yourself every single day, Sabrina. I can see it.
Yeah.
I can
Thank
tell that
you.
you've been working out. When I saw you, I was like, oh, yeah. Yeah.
Really?
Mhm.
Are you being serious? Really?
Oh, yeah. Oh, yeah. Absolutely. It was a
Okay,
lot
sorry.
of people that I saw that I was like, oh, that's what we doing. Yeah.
I be in the gym, y'all. Like I work out like so. Thank you guys. Thank you guys so much. But like when I look in the mirror, and I don't pretend. And this is the thing with people who have been in this area for a long time. People think we got it all together. We don't. I know I don't. I know I don't. Like I sometimes look in the mirror and I cry because I know the work that I be putting in, and it's the skin. I like move it around. And I was talking to Leah, and she's like, you need to talk to someone. There's actual like therapy over for this. This is a clinical thing. This is a clinical thing. So I think I'm going to talk to someone, y'all.
But I
But
think it's normal. I think that feeling that you're feeling about the skin thing, it's normal because you're not used to seeing your skin like that.
yeah,
So I don't want you to feel like, oh, like this is mental. No, this is valid. It's valid what you're feeling. We just need to talk about what needs to happen to change that. And for a lot of people, it is skin removal surgery, because for loose skin, that's the only resolve. There's no collagen peptide. You can work out, and you can work out and you can try to feel, which a lot of people have filled the gaps, but I see a lot of muscular men who still have like the breast tissue, who still have who have to have the skin removal surgeries. And I think that's a healthy thing to do.
I
I
think
don't
it's
think,
totally, I just feel like it's the next stage in this like journey,
yeah,
no? Right?
yeah.
We've worked so hard. We have worked so hard. This is a decade long, decades and decades I've been struggling against this, right? Decades. And it's like, I just want to like what I see when I look in the mirror. I love me. I love me, right? I'm
Yes.
saying aesthetically, I want to like what I see. But I got you guys, my surgeon, the one who did my reconstruction from the breast cancer, my surgeon got my panty covered. I got the paniculectomy covered.
Yes.
Let's go. Let's go. Let's go.
I love
So
it.
I cried.
Yay,
I cried.
friend.
I
Yes,
cried.
it's the best feeling.
So the PA is good from May to May. So May 27th. So I wanted to thank you guys. I'm going to try, because since I've been working out, I have been trying to build as much muscle as possible. That's all I've
Yes.
been trying to do.
Very
Like,
smart.
so now I have to shift my goal because the bottom half of my stomach is loose skin. The top, thank you everyone. The top half, there's still, I, back. There's still some. So now my goal for the next however many months is try and lower that as much, like maintain the muscle,
Absolutely.
but lower as much
Absolutely. I
because
love that for you.
yeah. So girl, I am just so. I'm so excited. So I just want to thank you guys for creating this space. It really, like I
Welcome, baby.
can't. Yeah, I can't tell you how much this space is needed. So thank you. And I love y'all so much. I gotta go.
Love you
We love
too.
you
Bye,
too.
Sabrina.
Bye everyone.
Thank you.
Did
So Miss
Andrea come back up? She didn't.
Andrea didn't come back up, but Tracy is here, y'all. So
Tracy.
we are going to let Tracy have the floor, and then we will wrap up after Tracy tells us how she's been feeling and why. You can unmute yourself, Tracy, baby.
Hey,
Hey,
you guys hear me
baby girl. How
okay?
are you?
I wasn't gonna jump on, but then Nurse Keisha, I was like, oh my gosh,
Aw,
this
talk to
weekend has
me.
been. I think the last couple of months, I have just like you, I struggled with like anxiety and depression probably for a very long time, and I would always start meds, and then it's just maybe like the cultural stuff of society with around medication, and then I wouldn't take it. And then the last couple of months, I just got tired of like feeling this way. I
Yes.
finally like dusted off the medication out the cabinet and said, I'm gonna do this. And I started back taking Lexapro. Um, and I wasn't taking it for a couple of days last week. I was just like, oh, I felt fine today. I don't need it. And that's what kind of like I had like a really bad anxiety attack. And a lot of people think that anxiety is like you're freaking out. And how I knew that something was off with me was that I was having terrible insomnia. And I was literally worrying about every little thing that went wrong that week. I was laying in bed thinking about it. And as I looked at the time, it was like 1, 2, 3, 4.
Yes.
The sun is coming up.
Yes.
The kids are gonna start needing me, and now
That's
I haven't
not
gotten
normal.
any rest.
Yeah.
And I just like I felt my heart racing, my hands were shaking, and I was like, I need this. I need the help to not only from at first I was like my kids need a better mom, but in order for me to be that, I have to like fully take care of myself in all areas, like I'm working on the physical on my journey, but it's also taking care of the mental part. So I got up out the bed because my plan for the day was just to be like, well, I didn't get any sleep. I'm just going to stay here. I'm just going to bed rot all day. So I got up and I took my meds, and I also got prescribed, I don't know if I'm saying this right, propranolol for my anxiety.
Yes.
So
What you think about it, baby?
that. I took it a couple years ago. They kind of have it. It's like working dual for me for anxiety and migraines. So this past weekend, it really kind of helped with my heart rate to kind of go down and kind of settle me in that moment to kind of bring me back to, okay, kind of just, all right. When you're spiraling into an anxiety attack, it's really hard to like recenter yourself.
Yes.
It's that I was on the flight side of things, and that
And
it
that's a
really kind
scary
of helped
place to be.
me.
Yeah.
Scary
Yes,
place to be.
because what I wanted to do was hide.
Yeah.
Like I wanted to hide, and I just kind of I took the kids out. We went out, and I'm glad I like kind of pushed past it, because in the past I would just like bed ride. I would just hide because I couldn't figure out how to help myself. Like, you know.
So,
Yeah.
so
So
this is
I
the
totally get it.
this is the thing, baby. When it comes to treating anxiety and depression, certain meds that your clinicians put you on, a lot of people think, because I even thought this, a lot of people think that, okay, well, I'm going to take my medicine today and tomorrow, oh, I feel so good today, I don't need to take it. That it's really not how those meds work. A lot of those meds, and I'm not talking about any meds specifically. You just have to research your med that you're on. Anybody that's in the chat, I'm talking to everybody. There are some meds that you have to take consistently so that your body can build up a level of you have to get your body to a therapeutic level. I don't know if I'm saying this right.
Yeah.
I don't want to talk too technical. Okay. And so once you have a therapeutic level of that medicine in your body, then it'll balance out those dopamine and serotonin and all of those, wherever the imbalance is at. Nurse Rock, you want to come up and explain it? Because I don't know if I can explain it probably as well as you can. But so when you're taking medicines like that, you have to be consistent with taking them, and you cannot just take yourself off of them, because there is a such thing as a withdrawal. And sometimes your withdrawal can be something that feels like a panic attack. So whenever you're coming off of those medicines, you need your clinician to either transition you over to something else to keep you at a steady state. Thank you, Nurse Rock. So that you can transition to something else, so that you don't have such an abrupt drop in those type of things. Nurse Rock, can you help me?
Yes, I think what you're saying is totally correct. And I'm at work, so I won't show my face, but I'm gonna come up here real quick. What you're saying is correct. That's all. Every med that we take when it's prescribed, they all have half-lives. And you have to times that half-life by at least 8. And normally that is what takes it the time that your body needs for it to be what we call at a steady state in your body, so that it will work at the optimal level that it should be working. So whenever you do the on and off, I'm not going to take it today because I feel better, you're messing with the state that the medicine is holding in your body. So then when you do that, you're going to go, it's almost like going backwards to zero. If you feel better, and I tell people this with blood pressure meds, with every med, since now I'm able to see my patients and do my stuff in clinical boo-boos, but I educate them, do not alter the way this medication is supposed to be taken, because that is what's been trialed. This is how it works, and this is how we get optimal results from the medication. If you ever decide to go off these medications, you do have to ask a clinician to help you come off. You can't just stop taking them. You are supposed to be tapered off of the medication, because then when you automatically stop a medication, that's when you become at risk for suicidal thoughts, dropping into major depression. Even if you started out taking something for anxiety, these medications do more than one thing. I love the fact that they did a combination and gave you propranolol, because anytime you have a panic attack, it's going to help control your muscles and not your heart won't race. And so that's a great combination. But you have to know that when a clinician does the research and says, from what I know of your history, this is med I want you on, you have to believe there's a reason why you're on this particular med. You have to communicate. And if you start to feel funny, or if it does not hold the whole reason why you got the med in the beginning, that's when you have to be like, hey, you said that this would make me feel better. Well, it makes me feel better here, but I still feel jumpy over here, or I'm not sleeping, or this is hurting my stomach, or whatever. Your clinician needs to be like your best friend. You need to not keep secrets from your clinician. You need to be very free to tell them what's going on with your medications. And I want to say one more thing. That's all I want to say about the medications. Because Keisha, you were right. You everything was cool. Sometimes even when I'm talking, you can't pull the word that you're talking about, baby. But you had it all. You had it together. I do want to say what I'm seeing in when I'm working with patients now, there is a lot of cultural stigma. And people feel as if you are, I'm gonna give you one instance. Some people even have told me that they felt like if they take medication, it's saying that they don't trust God, or they don't believe that God can fix it. And you have to really look at things in a way that, God has blessed people with different gifts. He's created things to help things be easier. There's nobody, and the clinicians are not telling you to drop your faith or your spirituality because we think that you should be on a medication. I feel like we need to realize that it's not highlighting a weakness. It is a treatment. It is a treatment. And you deserve to be able, just like you're doing this with your health, you really deserve a holistic journey where you have mind, body, and spirit in balance. And that's all I wanted to say, but I'm glad you guys were on, and I've enjoyed listening to you guys. I love you so much.
Okay,
All right.
friend. Thank you.
Bye, y'all.
Doc Rock.
Good
Doc
night,
Rock.
Rock.
Doc
Yeah.
Rock. I'm waiting for you to change the name.
I will soon. The Lord willing, I will soon. All right, drop me, Kima.
Love you.
All right, I got you.
Love you, babe.
Bye.
So Tracy, you got it, baby. So I want to say, first of all, you're doing a good job, friend, because you are addressing what's going on and you have reached out for the help. It's just knowing what to do and how to do it so you can have peace in that situation, because it starts with you. So, don't let, let me just speak for myself. Girl, I'm very strategic about who I allow around me, my triggers, my boundaries, and all of those things matter. And when you need time alone, because there are some times where you have to have your time alone so that you can refill your cup when you have poured it out to everyone else. You're entitled to those times, and you just make people respect your boundaries because you do have anxiety. And you don't have to walk around telling people, look, I have anxiety today, you're overstimulated. It don't have to be all of that. It is what it is. No, I'm not available today. I'm on do not disturb today. You don't have to explain nothing to nobody. When it's time for you to take your time to yourself, you take your time to yourself. But take your medicine, baby, because it is a chemical thing. It is a chemical thing. It is something that has to be treated, because I want you to live your best life, and I don't want you to have panic attacks, and I don't want you to be secluded, and I don't want you to feel like you have to isolate yourself. So take your medicine, baby. And Tracy, listen, I'm talking to you and me. Okay? I'm talking to both of us.
We're all in the
I've
same
been
boat.
there.
And Tracy, you're coming on sharing what you are experiencing and how you feel, but you're talking to two clinicians that have done the same.
Baby, you helping me.
Okay? Trust.
Because it feels good to know this shit don't just happen to me. Like, and we have to normalize these things, It is what it is. Anxiety and depression is a real thing, and it's real that it's being untreated. That's why we see so much violence and so many people snapping and all of these things, because they're not strong enough to advocate for themselves. But when we talk more about it and let people see, okay, well, yeah, I feel that. Well, yeah, I understand exactly what she's saying. Well, maybe I need to, it strengthens people when you're vulnerable about it. And a lot of people don't even understand that sometimes God will use you to be the vessel to heal someone else. That's why every chance I get, Tracy, if I can tell someone my story about cancer, my cancer survivor, and the thing that I went through, I tell that story because I know that's a testimony for somebody. It's going to heal somebody. It's going to strengthen somebody, so.
Yes.
Absolutely.
Oh my gosh. Thank you guys so much. I feel like I'm about to cry. I needed this so much. I just logged in before bed and I was like, you guys bless me. I love you guys. Thank you so much.
Thank you. Love you too, baby.
We love you, girl. Have a good night, baby. Kiss those babies. Okay.
Welcome in. Hello, everyone. Listen, this is really why we are in this space. This is why we created the Health and Hustle podcast. It's holistic care from A to Z, and you're getting it from moms, you're getting it from wives. We're sisters. We have many hats. We wear many hats. But this is our safe space where we can talk and chat. Don't get me wrong. I feel like everyone needs someone that they can call and like say, hey, this is what I got going on. You know, Keisha and I talk outside this platform, and thank God we met here in this space. The medication introduced us, and we have a beautiful sisterhood relationship. So when I'm going through some things, I will call Keisha and say, hey, girl, this is what I got going on. What you think about this? We have that type of relationship where we're not judging each other. We are really here to help one another. And that's what we are trying to bring to this space as well. So just keep that in mind, knowing when you see us on Health and Hustle Podcast is on, honey, tap in, join in. This is a absolute safe space to talk about all of the things.
Yeah, and we want to talk about things that you guys want to talk about. So if you have a topic or if you're experiencing something and you don't want to put it in the chat, put it in our DM and we will talk about it. We ask for topics all the time, honey. Look, Sabrina said, I stay bothering Jay.
Honey, listen, I love Jay. Yes, Tiffany, we do upload to YT. We do upload to YT. So our last live, I think, is already up there. The one from July 8th, excuse me, is already up there. Our lives have been running like 4 hours plus. So it's been taking us a little minute to get them uploaded. So we're trying to keep ourselves, on a little schedule.
Cute.
We can
talk to you. I'm a night nurse. I'll talk to y'all till the roosters start roostering.
Honey.
Outside me.
And I'm up at night. I am someone that suffers with severe insomnia. So trust, honey, we be up kikiing all night. This is our time. This is our time. So definitely
said Jay's her favorite human. That's so cute.
Yes.
That's so sweet.
I call Jay Legs. I don't even really say Jay when I see him anymore. I'm like Legs. Okay. But yes, absolutely.
This says it. I don't know which one. I
know.
The legs be legging.
The legs be legging. Skin be skinning, honey. All other things. So thank you all. Make sure you are following Keisha. I'm gonna turn it over to you. You can wrap us up. Any words for the people?
Well, I just want to say, stay true to yourself. Be the best versions of yourself for the people that love you. Pour into yourself so that you can be the best version of yourself for you. Show up for you so that you can show up for your family. No judgment here. There is no prejudice here. We are one. We are one big family. We are not always going to agree on the same things, y'all. So don't feel like if you don't agree with me, like you can't come up on the panel. We can. Right. We're very grown over here. We know how to. We have really great communication skills. I'm not a one-way thinker. Kima's not a one-way thinker. We understand that there's different cultural things. There are different family things that you were raised with. We understand that there are different dynamics with people. We're not. If we were all the same shit, we wouldn't even need. There wouldn't even need to be a community. But we're all different, and we can learn so many things from each other. But I'm saying, and so I'm praying and asking God that this space is a space that people come and they feel peaceful. They feel restoration over here. That they feel like they are talking to their sister or their brother over here, and what goes on here stays here, except for the people who make up whatever comments they want to make, in the chat. But hopefully they keep it cute, honey. How to mute on this side of town. So I love you guys. Yes, hey, Toya. Toya didn't want to come up.
I pinned I typed it in my page because we can't pin while we're in the live like this on the panel. So there's Kima Nichelle.
You know what? Let me drop down so you can close out. You want me to drop down so you can pin? Okay. Love you guys.
Let's see here. Is it lit? why it's doing that. However, but that's my page right there. The Kima Michelle is my ex nurse Kima's page. Make sure you're following the Health and Hustle podcast. Okay, we definitely appreciate you all being here with us tonight. Yes. Okay, and there's Charles Nurse Keisha's big page right there, so make sure you are following that page as well. Someone asked in the chat, when do we come on lives? We have agreed to once a week. Right now it's looking like Sunday, but that could easily change because, of course, Keisha works can work sometimes on Sunday. Okay, I'm usually off on Sundays for sure. So we say Sundays, but it could definitely change based on Keisha's schedule for the week. But right now we have committed to at least one day a week coming from the Health and Hustle podcast, because of course we have the Ask Nurse Kima podcast page. We have the Nurse Keisha page as well. So we have our other obligations outside of social media because we do wear multiple hats. We both are in school. So we out here hustling on a whole nother level of hustle. So we absolutely do what we can. This live will be posted on YT. So if there's anyone in the hallway that missed the beginning, you'll be able to catch the repeat playback over on YT. So you all have a wonderful night, and we look forward to seeing you next week. Peace and blessings.